What's going on, ladies and gentlemen? It's your boy Brad back with another video. And what I wanted to talk about in this one are 3 tips to help you preserve your mental health in nursing.
Are you listening? Nurse Pass. Beast mode. Grind.
I feel like this is a pretty important topic because burnout in nursing is very real. And the preservation of your mental health takes precedence over you caring for your patients. And that might not sound right? What I mean by that is the old cliche or the old saying that in order to be able to care for others, you have to first care for yourself. That's what I mean. So here are 3 tips to help you preserve your mental health. So the first tip, and it's important for a lot of new nurses out there, is not to schedule yourself for a lot of days in a row. 3 consecutive days, 4 consecutive, 5 consecutive shifts in a row. Whenever you first get out of nursing school, a lot of people are really gung-ho to get to work and get to grind and start making some money and get some experience under their belt. And in order to do so, a lot of times they come out of the gate gunning and they're just scheduling themselves a lot of consecutive days in a row. Now, there's nothing wrong with doing 3 in a row if that's the way that you like to do things, but I think it's important not to do too many in a row because you are going to end up becoming so consumed with work and so detached from your personal life that it can become depressing. It can weigh you down. It can lead to higher and more rapid levels of burnout than it would have otherwise if you had spaced your days out, giving yourself some time off to actually rest, recuperate, recharge, therefore that you could better take care of your patients. Tip number 2, try as best as you can not to take your work home with you. It's sometimes difficult, especially whenever you actually invest in your patients emotionally, which, you know, a lot of people really do. If you're a good nurse, I feel like to some degree you do that. You know, you care. That's, you know, whenever they ask that question in interviews, whenever you're trying to get hired for a job, why do you want to be a nurse? A lot of people's thought is, I care about people. And so as a natural humanistic response, because you care about people, you become invested in people. And therefore, sometimes it bleeds over into your personal life. A good tip to try to do is to proactively separate work from home life. That way, you know, work can be sad. I don't know. It just depends on what kind of environment that you're working in within nursing. But, you know, if you work in the ICU or ED, you come across some pretty sad cases and sad things. And if you're taking that baggage home with you in your personal life, then that's just another instance of work bleeding over in your personal life and you not being able to separate the two and therefore be able to take care of yourself. And tip number 3 is to take care of yourself. It's to take time for you to do things that you want to do. Take those days off whenever you need them. You know, they talk about taking a sanity day, right? You know, I mean, things like that are very important because you do absolutely, like I said, I'm reiterating, you do have to take care of you. You have to recharge the batteries because you cannot pour from an empty cup, right? It's very important, very important. I hope that you guys enjoyed this video. If you have any tips, man, leave them down in the comments below so that our other cohort here can learn from them as well. Maybe there's some gems out there that I don't know about and that they may not know about that they could benefit from and that I could as well. So guys, check the comments down below. You might find some other gems. I hope that you guys enjoyed the video. If you're new to the channel, be sure to hit that subscribe button down below. We're putting out content every week to motivate, uplift, and inspire you to be the best you can be. It's your boy Nurse Bass, and I'll catch you guys in the next one. Peace.